Next slide. This is what we're largely talking about. Protecting the vulnerable organ. Next. So that's the theme for the World Kidney Day. Are your kidneys okay? The intention is to detect early, protect kidney health, and every second Thursday in the month of March is our World Kidney Day, and the last one took place on the 13th of March, 2025. Next. So the question would be, how many of us know where the kidneys are? Is that bean-shaped organ just behind, a little bit behind, located in the posterior part of the back and the lower part of the ribs, protected by the lower part of the rib? It measures about 11 cm in length, about 6 cm in the width, with the depth of about 4 cm. Next slide, next slide. Continue. Next, next. Next slide, please. Yes. It's a paired organ. There are a few paired organs around, and the kidneys happen to be one of the lucky few paired organs that we have. And it weighs about 120 to 200 grams, and with an outer surface that is also that can be divided into what is called the anterior side and the posterior part called the dorsal side, and also has an upper and lower pole. Next slide, please. So, as we know, the functional units of the kidney is the nephron, and that's where the bulk of the filtering and its activity of cleaning up actually takes place. And it's just a conglomeration or a network of capillaries that initiates this filtering process. Next. So if it's assumed that if all the nephrons were linked up together, they could cover a distance of about 16 kilometers, or about 9.95 miles. That's to tell you, they look like thread, but if they are put together one after the other, they can be that long. Next, please. So, understanding the function of the kidney, we need to explore kidney role in health and homeostasis. We'll be quick with this set of slides. Now, it helps with daily blood filtration. The kidneys filter close to 50 gallons of blood every day, and is crucial for maintaining fluid and balance and removal of waste. It is also the kidney's duty to also help us keep the essential nutrients, keep the essentially needed water, and allow for excess water especially when the weather is cold. Next slide. What other function do the kidney participate in? Is the kidney is responsible for balancing electrolytes, sodium, potassium, calcium, and everyday homeostasis. Next. It is also the kidney's responsibility to take off toxins. Apart from the liver, the kidney is one major organ that is responsible for whatever toxins that get into your body from food, from drugs. It is the duty of the kidneys to take them out. Next. So a functional kidney helps in a long way, in a huge way, in ensuring that our body is prevented from harm. What about the hormonal role? It is the duty of the kidney to produce certain sets of hormones. One of them is renin. Renin is very essential in the maintenance of blood pressure, and it's involved in a complex but very essentially useful system called the renin-angiotensin-aldosterone system. That system is vital in the control of blood pressure, and it is also responsible for maintaining systemic vascular resistance. That's how the turgidity of the vessels, as it were. So it is also through this mechanism, the blood volume is appropriately maintained and blood pressure is kept in the right manner. So that means that once you have a patient coming down with maybe poor blood pressure control, especially for someone who's a known hypertensive, and you realize that his blood pressure control is becoming exceptionally worse, one organ you could think of in finding out if there's a problem with is the kidney. Next slide, please. Very importantly, sometimes we say, oh, why is it that most kidney patients come down with shortage of blood? It is the duty of the kidney to produce an essential hormone called the erythropoietin. That erythropoietin sends signal to the bone marrow to enable the bone marrow produce red blood cells in instances where there's shortage of blood. So, and when the stimulation isn't coming by virtue of an impaired function, you find that patients begin to present with reduced levels of hemoglobin, and as it were, anemia eventually. Next slide, please. What else does it do? So imagine this small little organ we call the kidney has so many roles. It also helps in the conversion of vitamin D. Vitamin D is very, very essential in giving us the active part of the calcium that is useful to us. So that's why you see most people when we tell them take calcium, we tell them get the one that has vitamin D, because that helps in better calcium absorption. So it's good for bone health, good for health of the teeth. Next slide, please. Next slide. So acid-base balance is also very important. It keeps the volume of the anions and the bicarbonate levels being produced in an appropriate level in such a way that efficacy goes on at the level of the cell in terms of functionality. So if the kidneys aren't working well, all this is also distorted in terms of the balance. Next, please. Let's move on. Let's move on. Next slide. So eventually, as I mentioned before, blood pressure control, blood volume is controlled, fluid retention is maintained if the kidneys are working well as well. Next, please. So now, generally, kidney diseases are described broadly into two: the acute kidney injury and the chronic kidney injury. Acute kidney injury is when you describe an individual coming down with renal disease that occur within 3 months. If there is a sudden deterioration in the kidney functions within 3 months, we're talking about acute kidney injury. And there are several factors, which we'll try and mention as we go on. And chronic kidney disease is if, assuming this kidney disease progresses beyond 3 months, we're dealing with a more chronic illness, and the approach is somewhat a bit different. And it's of huge global health issues because morbidity and mortality has been linked with the incidence of rising chronic kidney disease. And as we look in the next couple of slides, we'll see how tough it is for us as nephrologists to keep these figures down, because most times it's out of pocket in terms of payments, especially in our country, and you have quite a lot of persons with poor health-seeking behavior, quite a lot of persons with unhealthy lifestyles. Sometimes, even when you have the money, your level of knowledge is an issue, which sometimes intermingled with strong cultural belief, like whatever it is that is happening to them, oh, that issue that may be actually a kidney problem is actually a spiritual problem, or is something that should be solved in the church. So by the time they come to the hospital, and most times they're already in the advanced stage. Next slide, please. So you see, just as we have between 5 to 15 million individuals with acute kidney injury and even rising, we have close to 850 million persons worldwide, with about 17 million individuals having chronic kidney disease in Nigeria alone. And by 2040, CKD is being projected to be the 5th leading cause of years of life lost. This therefore highlights the urgent need for global strategies to combat the kidney disease. Next slide, please. So as you can see, as far back as 2017, we had CKD being twice in the volume of diabetes, 20 times that of cancer, and even 20 times that of HIV. But then those figures are astronomically increasing as we're beginning to have an increasing prevalence of about 11.1 as at 2017. And right now we're talking about prevalence in Nigeria close to 19 to 20%. Next slide, please. It's been discovered that 1 in every 5 men and 1 in every 4 women between the ages of 65 to 74, and half of the people that is above 75 have some form of chronic kidney disease. So we need to look. Next slide. And we've also discovered that there's a 63% age standardized disability adjusted life ages in low and low medium income countries. So therefore, that brings to the fore that the global toll of CKD is significant, and it is rising and unevenly distributed, and it is primarily driven by the demographic expansion. More people are being brought in, and our lifestyle hasn't improved as in geometric proportion with the volume of population that we're dealing with. So you have increasing incidence of CKD, as it were, as we progress. Next slide, please. So CKD in itself has 5 stages: stage 1, 2, 3, 4, and 5. 5 being the worst. 5 is when we're talking about estimated glomerular filtration rate less than 15 mils per minute. And for most individuals, once you're in stage 1 with 90 mils per minute or more of eGFR, that's fine. However, when we finally stick our head and say, oh, this individual has a chronic kidney disease, we're talking about when the eGFR is below 60 mils per minute per body surface area. Next slide, please. So that's the details of the staging I just gave you. Next. Next, please. So the question is, there are old assumptions and there are newer realities, especially with acute kidney injury. We need to also know that once we detect our kidneys early, which we're going to be discussing more later, to take care of that vulnerable organ, we discover that we have less number of persons coming down with acute kidney injury. Therefore, we have less people who also progress to chronic kidney disease and probably end-stage renal disease at the end of the day. So it's important to know that once we can pick renal diseases early, we could reduce eventually the progress to end stage. And then just for us to know, just for knowledge sake, there is also a window period called where you have the acute kidney disease. That's that gray window period between 70 days to about 90 days. We call that acute kidney disease. But once you cross the 3-month mark, you're dealing with chronic kidney disease. Next slide, please. Now, let's quickly look at some risk factors that may encourage the progression to CKD. That we probably divide them into non-modifiable and modifiable. Non-modifiable, there's really nothing much you can do because it's not related to what you're in control of over. For instance, age. As you get, the general belief is as you get older, you have increasing tendency towards the CKD. As they say, more in males. Then the ethnicity, we're talking about increasing incidences in that we've now even linked up with newer genes like the ApoL1 gene that has that is being currently studied to further buttressing the fact that it may be more common in blacks. And we've also found out that kids born with congenitally reduced number of nephrons, eventually, most times, often than not, develop a chronic kidney disease. And low birth weight, especially in young kids, if monitored and not proper care not taken, associated with activation of the RAS pathway, eventual blood pressure, and most times CKD at the end of the day. What about the things we can modify? Hypertension. Hypertension, if well handled, would help prevent the progress into CKD. What about diabetes? Very important. For those who are diabetic, once you take care of your blood sugar control, most often than not, it won't get there. What about the tendency towards you developing proteinuria for whatever cause? It's been seen that proteinuria is a strong risk factor towards the progression of CKD. So, and once we target reduction of proteins in the urine, CKD may be retarded. Then it's, of course, a total no-no to be involved in lifestyle practices like smoking, alcohol, increased salt intake, as we usually do. We love our salt, we love everything all spicy. It's, as you get older, that isn't very, very, very good. Then there are certain group of individuals that we've discovered, especially the pregnant women, who do not probably book early and don't take care of themselves. Hello. And when, hello, can you hear me? Hello, can you still all hear me?
Yes. Yes.
Yeah. Yes, very well, Doc.
Yes. So there are Doc, other set of, yes.
Thank you. Please, our participants, please, if you are not speaking, just mute yourself so that you don't interrupt our presenter. Thank you very much. Please, Doc, go ahead.
Right. So we've also discovered that there are a group of peculiar women, especially those who we've seen, who had very badly controlled blood pressure that could have been associated with what we describe as pre-eclampsia or eclampsia, or even post-eclampsia, coming down later with chronic kidney disease. And I've seen quite a few that have led to mortality. So it's also important when you have high blood pressure during pregnancy, not to just wish it away, that, oh, I'm fine, I've had my delivery, I'm okay now. Follow-up is very important because most times that alone is a risk factor towards developing CKD much later. Next slide, please. Next slide. Right. Before we discuss generally the indicators, in fact, I've even mentioned some of this. Once the EG, or as we usually describe it, estimated glomerular filtration, it's just a key indicator of whether the kidneys are getting better or not. And it's also good for monitoring. Once that begins to decline, oh, that's not a good sign. Assuming your eGFR was 78 in 2023, and by the time you're checking it's 32, that is suggestive that you're beginning to have progressively worsening renal function. Assuming also initially you have maybe 1+ proteins, and as time goes on, you begin to have 2, 3 pluses, those are not good indicators because they may suggest worsening or progress in the disease. Worsening symptoms. Initially, just know that the question will be, what are the common symptoms of renal disease? Just know that one of the few things you could find is that they may not have any symptom. You have a lot of people who walk into because they just want to do some routine check, only for them to find out that that the kidney function test or your urinalysis is totally deranged, and they have a kidney problem and they had no idea. So no symptom may just be your first symptom, but some of the early symptoms that may suggest a kidney disease may just be increased urine output at night, which we call nocturia. It may be reduction in urine output or no urine output at all. Then nausea, vomiting, face swellings, generalized body swellings, worsening blood pressure, as I spoke earlier. Then you now talk about itching of the body, then shortage of blood. Some may even go into outright seizures. So when you find that these symptoms are worsening, initially, oh, maybe just nausea and vomiting, and you now have other symptoms, that's an indication that your kidney disease is worsening. Please, next slide, please. So just as I mentioned, I've already mentioned some of this, and of course, we know that quality of life eventually is not so good for people who have CKD because of the difficulty in carrying out their usual daily function. Go ahead. Next. So, what are then the challenges with the current approach towards managing kidney? It is a rising prevalence of CKD and end-stage renal disease. It's a high burden of cardiovascular diseases. You have more individuals having cardiovascular derangement, also contributing to CKD. We also have the increasing deaths associated with it. These are all issues that are such a burden to us. Then delayed diagnosis. Sometimes patients would have gone from one place to the other, tried all kinds of things. By the time they come to the hospital, it's just about the time. The symptoms would have been so advanced gone that at that point, even intervention becomes late. Then you also have instances where even the cause of the chronic kidney disease becomes very difficult. Then, of course, even when you know what it is, people don't have funds to even get good access care. And of course, in instances where we'll decide, oh, this patient needs organ transplantation, the cost is so high, even donations are very difficult. Next slide, please. So what's our approach? We need to slow down the progress of CKD by tackling all those factors. We need to treat identifiable factors. Just to quickly mention, worldwide, the common causes of chronic kidney disease remains diabetes, hypertension, infections, as the case may be. In Nigeria, hypertension is still topping the chart, then followed by diabetes, then infections that may affect the kidney called glomerulonephritis. We have increasing causes from HIV. We have even more increasing causes now caused by prostate diseases, especially untreated, either from BPH or cancer of the prostate, even stones, kidney stones, bladder stones, as the case may be, in the females, polyhandled leiomyoma, or as we call fibroid commonly, or even malignancies in women. That's why it's always good to just quickly check. If you suspect there's a mass, there's something happening in your womb, you're not so comfortable, you're spotting unusually, do a scan. We'll dwell more on that later. So tackling all these causes. Then again, don't forget HIV. You know now the figures with HIV aren't going down despite all our intervention. And you know, because of the thing we're facing now with foreign interventions, thank God for whatever we're doing in terms of government interventions, we still have quite a lot of individuals ending up with HIV-associated nephropathy, and even some more peculiar ones that we are beginning to see, described as HIV-induced complex diseases, immune complex diseases. We also have, so we think that at this point, taking proper steps towards proper planning, towards long-term renal replacement therapy may also be a good way to also start than dragging if there's an option to intervene. Next slide, please. So this just to quickly tell you the burden of CKD costs worldwide, over 400 billion. Next. So management and treatment strategies are targeted towards improving our diagnostic approach towards the kidney disease itself, and we need to early detect. That's why we're here. How do we early detect? Of course, we need to quickly know that you need to have good knowledge of what we're dealing with, examine this patient quickly, make sure the symptoms that may suggest CKD, you quickly pick them up and start investigating. Next slide, please. Basic thing as a urinalysis. Urine analysis may just be the only way to go. Urinalysis. Urine analysis can pick up proteins, and when proteins become even smaller than can be picked up by the regular urinalysis strip, your Combi 9 or 12 as the case may be, we could do things as urinary albumin creatinine ratio or even urinary protein creatinine ratio to assess even smaller quantities of protein, which you call microalbuminuria. Then, yes, an option of also quickly checking your blood. Hello?
Yes, we can hear you.
Yeah.
Please, if you are not, please, can you mute yourself so that you don't interrupt our presentation? Thank you, Doc. Please go ahead.
All right. So, apart from just urinalysis, which can be done in most good labs, there are simple basic blood tests you could do, which we call kidney function test, also otherwise called serum electrolyte urine creatinine. You could go there and check for whether you have features suggestive of a kidney disease. Ultrasound is available in the environment. We can quickly check there are certain type of illnesses, kidney disease, that once you do an ultrasound, you find that the kidneys are small, or may give you an idea of what could be the cause. Or like chronic glomerulonephritis, the kidneys may be small, or you're dealing with chronic pyelonephritis, the kidneys may be small. But then in instances where you find that the kidneys are normal or slightly increased, like HIV, diabetes, or maybe you're dealing with myeloma kidneys, all these may help you point towards the direction. And there is an inherited type of kidney disease called autosomal dominant polycystic kidney disease, if it happens in the older ones, or the autosomal resistant polycystic kidney disease, if it happens in the younger one, that ultrasound can easily sort out. And instances where the cyst looks a bit complex, CT scan can help you delineate what you're dealing with. CT scans can also help you sort out in instances where you're not sure where you're dealing with a tiny stone. You can do a CTU, CTIVU to assess whether there are stones present in instances where ultrasounds can be of help. Then, of course, there are instances where you've done all this and you're still not sure if whatever kidney disease you're dealing with, biopsies are available. Next slide, please. What are the common complications of chronic kidney disease? Shortage of blood, I mentioned it, called anemia. There's an entity called bone mineral disease, where the calcium phosphate metabolism begins to become affected. Patients are predisposed towards osteomalacia and osteoporosis, predisposed towards fractures. Then you have uncontrolled hypertension. Remember what I said earlier on, once you find your blood pressure hitting the roof unusually, the drugs you usually take do not work again for you. You need to think about checking those kidneys and be sure whether, that's why we're asking that question, are your kidneys okay? Are your kidneys okay? Then you have them in some instances with people developing an outright heart failure or pericarditis. That may also occur as a cardiorenal syndrome. Then you have the people coming down with refractory edema. Refractory edema is when you've taken tablets. Sometimes you go as far as taking IV medication, parenteral medications like diuretics, and yet the fluid around the body would be difficult to go down. You may even have to go as far as doing dialysis and do ultrafiltration to get the fluid out. You also have quite a lot of them coming down with malnutrition. It's such an issue because because of the illness and the bloatedness, digestion and absorption is impaired. The desire to eat is reduced because most of them have nausea and vomiting. Then you have issues with even inability to be able to buy and feed well because probably that individual is saving money for his next dialysis, and of course death. Next slide, please. So the healthy lifestyle is very necessary. You have to take kidney-friendly diets. You need to take diets that have low sodium, low phosphorus. You need to engage in regular exercises, not just for your cardiovascular health. It's also very good in, making sure you don't add weight. You understand? And of course, you know that there's an entity called obesity-induced kidney disease, or obesity-related nephropathy, which is something related to being larger than you should be for your age and sex. So exercise will help do all that. Exercise has also been found to also indirectly help in blood pressure control. So you need to also be very, very, very intentional. That's the word. You need to be intentional with your blood pressure care and your blood sugar control. Be intentional with it. Don't leave it to fate. Avoid toxins. In our environment, we do a lot of over-the-counter pain tablets called non-steroidal anti-inflammatory drugs. They're not very safe. They're not safe at all, because if you take them recurrently for a while, they can just lead to chronic kidney disease directly. Next slide, please. So more specific targets is towards ensuring that the appropriate drugs are given, and we have several of them in our environment. We have angiotensin converting enzyme inhibitors, we have angiotensin receptor blockers. They are available. We have the calcium channel blockers. We have beta blockers that will help, especially for those of them who have tachycardia, as the case may be. But generally, renal protection is key. Salt reduction is, as I say, reduce, take just a pinch of salt, if as it were. And as we say as well, improving your sugar control, ensuring that your hemoglobin A1C is less than 7% goes a long way in ensuring that one doesn't end up with diabetic kidney disease. And generally, for those who have symptoms of kidney disease, we usually advise stay on low plant protein. What are your low plant proteins? Take things that are of high biological value. Plant proteins include beans, soya beans, okwa, granite. So as one begins to have advanced kidneys, we'll find out that this puts more work in terms of metabolism and waste on the kidney. So we prefer proteins of high biological value. So white meat is safe. Chicken, turkey, without the skin, of course, fish and snake, they're all safe. Then, of course, make sure that your cholesterol levels are good. Then, in instances where you're dealing with anemia, of course, you have the option of taking hematinics, and there are, of course, it's always been available, the iron, parental iron supplementation, or even the erythropoietins, the erythropoietin stimulating agents. They are also available. That have been seen to improve quality of life and reduce retardation in occurrence of anemia, with target being 11 to 12.5 grams per DL. So, next slide, please. Now, when you've done all this, there's a role of dialysis. We have lots of dialysis centers springing up all over the country right now, and we're beginning to know more about how to handle patients on the machine. So the dialysis is just a process where waste in the human body is just taken out, all right? And in layman term, cleaned up blood is sent back to the patient. So if you have a patient with high potassium, by the time the blood flows through the machine, the excess potassium is taken back and regularized back towards the normal values. If you have instances where you have low sodium, the sodium levels are corrected and restored back to the same level. Same goes for fluid. There's also a means where individuals that have excessive fluid in their body, and remember I mentioned retractable edema as one of the causes of one of the complications you may find with renal disease. And you've done everything, you've taken your tablets, you've done IVs. Dialysis comes as an option to help in taking care of these patients. And when all this is done and patients is a need for transplant, transplantation offers solutions to a patient who has chronic kidney disease. And once transplant is done, of course, lifestyle improves, quality of life improves. Next slide, please. What does the future hold? There's a lot of research going on in terms of gene therapy advancement. Of course, we believe that all these emerging therapies will help shaping the future of care for patients. We have stem cell research going into regenerative medicines where we're thinking about, repairing damaged kidney tissues instead of just doing transplantation. We even talked about even what we call biogenic kidneys, artificial kidneys, where you won't be bothered about donations anymore. And there are quite a lot of other things. And there are even newer research into the gene I mentioned earlier, the ApoL1 gene, where we think as time goes on, we'll have that solution in terms of medication that has been found to target the gene itself and prevent progression towards renal disease. Next slide. So, in conclusion, the importance of understanding the kidney and its progression is crucial for each and every one of us who are health practitioners, health lovers, and all those who seek better health care in enhancing patient care and our own health and that of our relatives. And there are several management strategies that we have now. So effective early strategy, early detection would help take care of that vulnerable kidney that just looks like a little bean, but does so much, which, if well handled, will improve patients' quality of life. And we know that with God on our side, with more knowledge being thrown into the field, we hope that in the nearest future, we'll be able to offer more and provide hope for many. Thank you so much for having me. It's been an honor to address you today. Thank you.
Thank you so much, Dr. Stanley, for this education. Yes, very well.
Okay, thank you very much. It's a pleasure to be here this evening to speak to this great audience. I would like to appreciate the organizers of this seminar for the opportunity to speak this evening. Dr. Stanley, that spoke before me, has said a lot about the kidney. He has said a lot about the anatomy, the physiology, and so many things about the kidney. So I will just be talking about fruits and herbs that can help, that are useful or important for kidney health. So briefly, I'll just be talking about one or two of them. I'll pick out major fruits and fruits and herbs that are beneficial to the kidney. So next slide, please. Okay, so I wouldn't be saying much about this because Dr. Stanley has actually dealt with this extensively. He has told us the vital roles of the kidney, and I just brought out these four, although there are many others if you had followed his lecture. So the first, I'll say filtration. He has explained clearly that the kidney is important, filtration of waste and excess substances from the body, and it also helps in regulation of electrolyte balance, which is very important in ensuring that the blood pressure is maintained. He has also talked about the importance of the kidney in production of red blood cells, produces the hormones erythropoietin that stimulates the production of red blood cells. He has also talked about homeostasis, where he talked about the acid-base balance. All these functions we have actually looked at before now. The importance of the kidney. The kidney is a very important organ in the body, and I'm glad that we are talking about it today. Next slide, please. So he actually even said he had actually given a little points on the importance of diet and diet in kidney health. So diet is very important in kidney health. And just like every other disease, we know that diet plays an important role in the maintenance of every organ of the body. So diet is important because it reduces the risk of kidney diseases, which he has even said during his presentation. So a balanced diet is very important because it lowers the likelihood of developing various kidney diseases. It also helps as he said, and as we all know, the kidney is an organ that is, when we talk about blood pressure, we talk about diabetes, you always have to relate to the kidney. So the diet helps to lower blood pressure And when we eat a nutritious diet, it can help in maintenance of blood pressure and also blood glucose. It also, proper nutrition is also important because it helps in, it has minerals and, components that are responsible in the elimination of waste and toxins from the body. Next slide, please. So we are going to talk about, I just brought out top fruits and herbs that are beneficial for kidney health and can also help in kidney diseases. And fruits and herbs are very important, as we have said earlier. And why are they important? This is because fruits are rich in vitamins, they have minerals, they have antioxidants, which are essential in reducing kidney stress and also improving the function of the kidney. All these things are, all these components are, the vitamins, the mineral, and antioxidants are very important in maintaining kidney function. They also help in maintaining hydration, and also proper diet fibers can aid digestion. So I'll give examples of some of these plants and fruits that can be beneficial in kidney health. The next slide, please. So top fruits, I just brought out these 4 fruits. They are the top fruits that are benefits in kidney to ensure that your kidney stays healthy. And top on the list, we have the berries. The berries are actually rich in antioxidants. And when we talk about being rich in antioxidants, they are capable of scavenging free radicals that are capable of causing diseases. They also help to reduce inflammation, and they protect the kidney against chronic diseases. There are several studies to show the importance of berries in ensuring kidney health. And specifically, I brought out main examples like the blueberries. We have the strawberries, the raspberry. And if you remember, when Doc was speaking, he said you should consume diets that are low in potassium, low in sodium, low in phosphorus. And these fruits here are actually fruits that are low in potassium, and some of them in phosphorus and sodium. As we go, we'll see that. And they are also they contain high antioxidant levels. The next fruit I have here is apples. Apple is high in fiber and vitamin C. Vitamin C is also very important because it has also antioxidant, and it has an anti-inflammatory property that can help in ensuring that the liver gets well. The kidney is fine. Then apples can assist in reducing cholesterol, improves even heart health. And as I said, it also is low in potassium, low in phosphorus, is low in sodium. And of course, we'll call them the kidney-friendly diet. And we have watermelon. Watermelon is a fruit that we also readily have around us. And it is a hydrating fruit. It is packed full with water and the antioxidants and vitamin C's that are capable. Can you hear me? Hello?
Yes, we can hear you, Doc. Doc,
okay.
We can hear you.
Okay.
Please, if you are, just please, if you're not speaking, if you're not our presenter, just mute yourself so that we can have a smooth presentation. Please go ahead, Doc. Thank you.
Okay, thank you very much. So the next fruit is pineapples. They contain bromelain, which has anti-inflammatory property, and they are also beneficial to the kidney. If you look, most of these fruits that we have mentioned have anti-inflammatory property. They are antioxidants, and these are very important in cases of diseases like the kidney diseases. They help to prevent inflammation. They help to protect the kidney and scavenge free radicals that are capable of causing diseases. Next slide, please. So the role of herbs in kidney function. We have herbs all around us, and so many of them we could even consume as food, and some of them as tea, and all these herbs contain, we call them secondary metabolites in pharmacognosy. We call active ingredients, compounds that are capable of eliciting pharmacological effect when taken. And as a result, if they can help you stay healthy and also capable of combating diseases. So herbs are very important, and that's why we're talking about them. And we have some herbs that actually possess diuretic effect. Some of the drugs that Doc has talked about, in fact, one of the major drugs that is used in kidney diseases are diuretics. And we actually have natural products, plants that possess this diuretic effect. So we'll look at some of them as we go. Next slide, please. Next slide. Okay. So I brought out some of the plants, and actually the ones that are used traditionally by traditional medicine practitioners and have also been tested scientifically and have been shown to possess the activities. So the first on the list is the dandelion leaf or root. This is usually taken as a tea, is taken as tea. Most of the traditional practitioners who use this, they take it as tea, you infuse it, and then you take a cup in the morning and a cup in the evening. It's actually a natural diuretic, and another study has shown that it has nephroprotective activity. Kidney in animal, this study was carried out in animals, and kidney damage was induced, and this plant was used in treating, and those parameters were being checked for kidney functions were found to improve even after kidney damage. So it has been shown that this plant also, aside from its diuretic effect, it also has a nephroprotective effect. Next on the list is the nestle leaf. The picture, so I'm sure maybe some of us have seen these plants around us. I also have the Yoruba name and Hausa name. It's called Efonyanrin in Yoruba. It's called Agaba in the Hausa, and it's called Agamevu. That's the dandelion. Then we have a nestle leaf. Nestle leaf, also that's the picture there. It's rich in nutrients. It supports kidney function. It possesses anti-inflammatory property, and also has been shown, studies have shown that it has a nephroprotective effect. Next slide, please. Next slide. Okay, thank you. Okay, so we have parsley. You see that most of these plants I'm mentioning are things that we actually have around us. And when we incorporate this into our diets, it actually helps in keeping our kidney healthy. So we have parsley. Parsley promotes urine production. So that helps in reducing the risk of kidney stones. And this has also been shown scientifically to possess that activity. Then we have the ginger. Ginger is a very common plant that we use around us. We use it in our drinks, cooking our food. We use it for different things. And it also contains, we know it is rich in antioxidants, and it has been shown to reduce inflammation in the kidney. The next slide, please. Then we have turmeric. Turmeric is also here, and turmeric also possesses anti-inflammatory activity and is capable of protecting the kidney cells. The last one I have here, the number 6, is beetroot. Beetroot has also been shown to possess diuretic effects. All these herbs are beneficial for kidney health and can also help patients who are down with kidney diseases. They can incorporate them into their meal. They can incorporate them into their meal. Of course, we'll talk about moderation, because you need to include them in moderation. So once you include them properly in your meal, and you find out that they are actually beneficial for kidney health. The next one, please. Next slide. When we talk of kidney health, we must talk about hydration. Hydration plays a very important role in kidney health. So especially now that we have the very hot weather, it's so hot everywhere. I'm in Jos. Jos is known to be cool, but the weather is actually hot, So the hydration is something that we must preach to everyone around us. We have to consume water. We have to make sure that we are always hydrated. It helps in flushing out toxins and waste. It also helps, in flushing through the urine. So in order to keep our kidney healthy, it's good that we hydrate often. So it plays an important role in kidney function. And water also helps maintain a delicate balance of electrolytes. And we know the recommended intake is usually about 2 liters for women, 2 to 3 liters for men. Averagely, take 2 liters daily. And we have some fruits that have been known to be good, that can help in hydrating. And watermelon, we know watermelon, these are common fruits. I think I talked about it earlier. Watermelon, we have the cucumber, we have oranges. We can actually add this to our diet. It helps in hydrating us. Thank you. The next slide, please. Then essential nutrients. I think while Doc was talking, he has mentioned 1 or 2 of these nutrients that are essential and important for kidney health. I just thought to include them here and tell us some of the fruits and vegetables or food where we can find them. We have potassium, which is important for fluid balance, and we can find them in bananas and oranges. We have magnesium. This supports the blood pressure, helps in maintaining blood pressure, and we can find them in leafy greens like our spinach, and then we have them in almond nuts, in cashew nuts, we have them in flaxseed and chia seed. But then we have our vitamin C, very important. It helps in boosting the immunity and is high in antioxidants, and we can find that in our citrus fruits and in our berries. So all these are very important. And of course, we advise that we take whole grains and fruits. And I think it said something about protein. You know, we need to take protein and whole grains, preferable. At least avoid processed grains. The next one, please. So here I said some things on this, so I wouldn't waste much time here. I just felt that it would be good to include food or things that we should avoid if we want to keep our kidney healthy. And he has said a lot about sodium, salt intake. You know, it's very important that we reduce that, and then avoid processed food. Very important. We are in this generation where most people want fast food. And I think it's good that we're having this seminar to be able to educate us and tell others that it's good that we go back to the basis, the natural, that has been naturally made available to us. And these are things that can keep us healthy. So processed food, a lot of this processed food contain additives and preservatives that contain some of these toxins and chemicals that are actually not beneficial to the kidney. So it's good to avoid processed food. And then excessive protein. When the kidney is already sick, so a high protein diet will also increase the workload of breaking down and removing toxin and filtering, and it brings more work on the kidney. So if someone is already having chronic disease, he needs to be careful and watch the type of protein that he eats. Then we have sugary drinks and beverages. Also, this we know that will make this will affect the patient because it increases issues of insulin-resistant diabetes, and eventually which will negatively affect kidney health. The next slide. So I just brought ways through which we can prepare some of these herbs and fruits, and we can easily take them. They are simple preparations. You don't need any special training to be able to prepare them. They are things that we can easily make in our houses. That we can make smoothie with watermelon, with our berries, our spinach, and we take them. We can, the granulon and the nest are actually taken as tea. You can brew them in the morning, brew it in the evening, and you take. Then we have the parsley and some of the other vegetables can be made as salad. You can take them as salad. And then instead of snacking on fast food and snacking on processed food, we can snack on our apple, we can snack on some of this fruit, pineapple, oranges, and some of these fruits that I had mentioned earlier. Next slide, please. So in conclusion, incorporating fruits and herbs along with maintaining a balanced diet, proper hydration, and positive lifestyle changes can greatly contribute to our kidney health. So awareness of food choices and actively managing lifestyle factors. He has said a lot about lifestyle factors, the exercise and so many other things will empower individuals to enhance their kidney function and overall health. And then continuous education like what we are having now and professional support are key in making informed wellness decisions. So I'm glad that we're having this seminar. And I believe that information gotten here would also be related to others, and continue to educate people on the importance of maintaining, taking care of their kidney and ensuring that their kidney is fine. So I think with all this, we'll ensure that at least Nigerians stay healthy. And we have seen the prevalence, the statistics, they are high, that we'll be able to help Nigerians to stay healthy and keep their kidney healthy. Thank you.
Thank you very much, Dr. Temitayo, for this